Hello, I'm Dr. Jonathan Runion here at Runion Dental Group, and we're going to put together a video of our most commonly asked questions from our patients that have already gone through this process.
My name is Dr. Aras Mortazavi. I would say the number one most commonly asked question that people have is, am I going to leave here with teeth in my mouth?
Yeah, hear that all the time, and it's such a common question because it's the embarrassment. It's not wanting people to know that you've been through this process and going out there and not having teeth. So here at Runion Dental Group, we believe in a philosophy of anchoring the dental implants into core basal bone, where that bone is very strong and provides good stability from those implants right away. Because we utilize those advanced techniques, we're able to really promise our patients a fixated, permanent set of teeth immediately after surgery that are custom made to them. And that's something that we really pride ourselves here, and it's really been able to build our patients' confidence over the years.
So Dr. Runion, patients often ask, what can I eat after surgery? What can I not eat? How long do I have to wait for proper healing? What are some of the limitations of getting these appliances?
Yeah, as exciting as it is to get those new teeth and to really want to show off the smile, we have to be patient and we have to let the gums and the bone heal around those dental implants before we use them, let's say in a full scale, chewing and eating whatever you want. So we tell our patients, let's really restrict ourselves to a soft food diet, not liquid diet, but a soft food diet where we're not putting excessive stress on those dental implants during the healing process. And a lot of our patients find they can maneuver around their diet for a few months, get the proper nutrition they need, get these implants healed, and then by the time that happens, man, they're excited to really start going into the natural foods that they really have wanted for a long time.
And during the healing process, I've seen patients, everyone's going to heal differently. That depends on your medication, your age, honestly, if you're following instructions or not. I've seen majority of patients show up within a day or two with minimal to no swelling. Of course, it's natural to expect and see some swelling after surgery, but really if you can stick to that soft diet Dr. Runion was talking about for about 3 to 5 months, it's an investment not only on your part, but also our part, both financially and honestly with physical, the amount of work that goes into it. I mean, I think hugged a lot of patients that always tell me Dr. Runion's changed my life, and they're always crying, and I think it's very rewarding to see that. So
yeah, I think a few months of taking it easy is well worth it in the long run. I agree.
For sure. Dr. Runion, another concern that patients have is, I have a partial, I have a denture, I tend to gag easily. Am I going to be able to tolerate this? Will the appliances cause me to gag? Is there anything you can kind of shine some light on that?
Yeah, it's very interesting. Patients that have that strong gag reflex, I mean, it can be embarrassing. It can be something that they've avoided the dentist cleanings or maybe getting some work done because they gag so much. They don't want to go in the chair and really cause that scene. So by the time they get to me, that a lot of times that can be their number one concern. So we overcome that through various levels of techniques. We use sedation to get through the procedure itself. The appliances that we make are very thin and streamlined. They don't cover the palate. They don't extend clear to the back like a denture would. So these patients are, I mean, a lot of times emotional to hear that we have solutions for each step of the way to where you can really take care of that gag and get them into a full set of teeth and that not be a problem for the rest of their life. So it's pretty exciting.
Yeah, absolutely. I don't think I've seen a single patient who has a gag reflex or discomfort have any issues during the surgery or with their appliance.
Yeah, completely agree. Yeah. We got solutions for that.
The most common thing we hear, Dr. Runion, is, I have a lot of bone loss. I was told I don't have enough bone. What do you have to say to that?
Yeah, very frequently patients come in, they were told at other offices, hey, I don't have enough bone for dental implants. Either I'm not a candidate or I need extensive grafting that will extend the treatment time up to 8 months, a year or more. And here in our office, we have strategies to take someone who has no bone, find remote anchorage places where we can find good hard bone to anchor dental implants to, all while avoiding the grafting process, which can be costly and lengthy and sometimes even painful or even not successful. So we overcome that by finding good hard bone in remote places and able to place those implants very solid, and then like we talked about earlier, get those teeth anchored in right away.
Absolutely. I would say if the technology and the skill set's there, I've rarely ever seen a patient not have enough bone.
Yeah.
Like you said, there's always bone. You just have to have the technology and the skill set to find that bone, and Dr. Runion can pull it off. So
Yeah, I feel very confident and proud of our group where we bring in those patients that really feel hopeless.
absolutely.
They've sometimes struggled for maybe an additional 5 years because they
Long
were told
time.
they're not candidates. They find us, and before you know it, they're in fixated teeth.
Yeah. So I hope that answered some of the questions you guys have. We're here for free consultations. You're welcome to give us a call. Come in, we'll evaluate, do a free consult, free x-ray. You're definitely not alone. There's a lot of people out there that are missing teeth, lacking confidence, not able to eat the food they want, and we'd love to see you. So give us a call and come in, schedule a consult. We'll take good care of you.
I speak right in line with Dr. Mortazavi. We encourage you to reach out. We love to educate you. We love to show you what you're coming in with, what's possible, and at minimum, you leave much more educated on the options that are available to help you throughout the eating and chewing process. Thank you for listening.